Chapter 26 covers stress and problems that are associated with stress. Over 40% of adults experience adverse effects from stress. So homeostasis, it's the body's compensation to minor changes in its needs or its environment. And we've kind of talked about homeostasis like all semester. A stressor is a factor that creates significant changes in the body or environment. It can be physical, psychological, or both. Some stressors include pain, trauma, anxiety, fear, infection. Each person perceives stressors differently. Something that might be easy for you to cope with might make someone else depressed. And really, stressors can change in how you cope with them based on other things that are going on in life. I think we kind of all can understand that. Like if you're, not feeling well, then, you get something thrown at you, you might not deal with it as well as if you were at your best and the same thing got thrown at you, if that makes sense. Stressors can even be good things that make you excited. When we talk about, stressors, like positive stressors, that's like motivation, right? Or maybe it's something that, makes you nervous, but again, motivates you to work or something like that. A lot of times when we're talking about stressors, I bring up like your stressor might be that you have an exam coming up and that motivates you to study for it. If you didn't have any stress around that upcoming exam, and again, that's just one example of a stressor that could motivate you. If you didn't have any stress about that upcoming exam and then you don't study for it. So stressors can be positive or negative. They can be good things that make you excited. They can be things that you have trouble coping with and make you depressed. They just, they vary. When we develop coping mechanisms that help us function, stressors can have a positive influence on our bodies. But when the stressor is severe or the person can't cope well with it, the body is affected negatively. Stress can cause vasoconstriction that leads to inflammation and necrosis, causing ulcers in the mouth or periodontal disease. It can cause necrosis in the GI tract or kidneys. It can exacerbate a chronic illness like COPD or chronic infections like herpes. Stress can lead to elevated blood pressure and heart rate, bronchodilation, and increased ventilation. We think increased ventilation sounds good, right? Like, oh, I'm breathing better. But increased ventilation is actually hyperventilating. So that's not good, right? Increased blood glucose levels, arousal of the central nervous system, and decreased inflammatory and immune responses. This lays out the stress response for you. This is on page 617. So if you need to get a visual of how that stress system works, here it is. So some specific problems that stress can cause are headaches. We talked about ulcers in the mouth and periodontal disease, as well as vasoconstriction. And since it can decrease the abilities of the immune system, it can lead to chronic infections, and it can lead to physical and emotional distress as well. This is some stress-related disorders. This is just some of them. This is on page 618. So when we think of stress, we think of like mental stuff, right? But with stress, like I said, can cause issues in almost all of our systems as well. Prolonged severe stress can lead to renal failure from prolonged severe vasoconstriction and reduced blood supply to the kidneys. Stress ulcers can develop in the GI tract from the vasoconstriction in the gastric mucosa that decreases the mucosal regeneration and mucus production. And again, infection because of the depression of the inflammatory and immune responses. Prolonged stress can slow the healing of tissue after trauma or surgery. There is an increased amount of cortisol that reduces protein synthesis and tissue regeneration, and increased catecholamine levels lead to vasoconstriction and a reduced blood supply, which reduces delivery of nutrients to the affected area. PTSD, or post-traumatic stress disorder, is a serious consequence of a major disaster. It usually occurs within a few months of the event, but it can cause symptoms even years later. Many people with PTSD self-medicate with drugs or alcohol, developing a dependence. It's important to learn to cope with stress. Some things that help with coping with stress are ensuring adequate rest and a healthy diet. Usually when we're stressed, that stuff doesn't happen. But this, like I said, if you kind of are aware of that, then it can help. Use creative solutions to minimize stressors and adapt quickly to stressors. Regular moderate exercise, engaging in distracting activities, and counseling and support services, as well as relaxation techniques. And that's it for chapter 26 on stress and problems associated with stress. Another one that's very, short and to the point.